Hello, everyone. Welcome to Leading Rural Healthcare, where we're having conversations beyond the margin. Where every other week, we're bringing you real rural healthcare leaders with real challenges, making an impact in their communities. I'm your host, Brendan Hurley, and joining me today is Tina Gillespie, CEO of Harrison County Community Hospital in Bethany, Missouri. Tina spent more than 2 decades working in rural healthcare, and before stepping into the top role at Harrison County, in 2017, she served as Chief Financial Officer, bringing a strong financial and operational perspective to leading a rural health organization through growth and transformation. Harrison County Community Hospital is a critical access hospital servicing Northwest Missouri. It's been expanding services, investing in its workforce, and is preparing to open a brand new facility designed to meet the community's needs for decades to come. T and I know you've got a lot going on and some exciting things on the horizon. Welcome to Leading Rural Healthcare.
Brendan, thank you so much. It's a pleasure to join you today and have a good conversation about rural healthcare, which is a passion of mine.
Yeah. Well, for listeners who may not know Bethany and certainly may not know yourself in Harrison County Community Hospital, how would you describe to them the role the hospital plays in Northwest Missouri?
Sure. I'll start with just kind of where is Bethany, Missouri? Bethany is actually located, I say, halfway between Kansas City and Des Moines, Iowa, right along I-35. If you've ever been through that corridor, you've probably stopped at Bethany and might have even ate at our world famous restaurant, Toot Toot Restaurant. So a lot of people, when we say we're from Bethany, that's what they say is, oh, toot toot. Um, but Bethany is a smaller community, about 3,000. The county is about 8,500 people, and we serve kind of around 13,000 people in southern Iowa and then the adjacent counties around Harrison County. Um, and as you said, we are a critical access hospital. We're a hospital district in that an independent hospital district in that we are governed by 6 elected board members, supported in part by a local property tax levy. So that was voted in back in 1989. And really, I think what you asked the question of what does the hospital really mean to the community? Well, first of all, it's not just a building, right? It's our safety net, it's access point, it's the heartbeat of our community, it's jobs for many people and good jobs and professions. And it's just exciting to be part of this rural health care. I find it a privilege actually to serve in rural health care.
Yeah. Well, you didn't start there, right? I mean, you didn't, I don't know your story, so this is exploratory for me, right? But, you went to school, got a finance degree, became a financial advisor, right? So you were adjacent to my industries, I mean, financial services as a broad term, right? I mean, what led you into healthcare? Was it organic? Was it in the family? Did you have clinicians? I mean, what tell me that story first before we kind of get into you becoming CEO and so forth.
Sure, you're right. I do have a finance background and did work in the financial services industry, even serving as a stockbroker for a while. So
Yeah.
my own office. I found that that was maybe not my forte and that I wanted to be, I always loved helping people. That's definitely helping people with their
Yeah.
finances. However, my mother was a primary care physician,
Hmm.
and she at first was a nurse and then became a primary care physician. And so I really think that healthcare has always been something I wanted to do, but definitely not be on the clinical side, but more on the business side.
Yeah. Was there a moment in your lifetime, growing up with your mom where you that defining moment came where you said, I'd rather help administer all this. Being a clinician is not where I want to be.
I think organically it just happened. I don't think that necessarily it was that one moment.
Right.
I would say, however, for business wise,
Yeah.
my grandparents owned a little grocery store, and from the caps, from 5 years old, I learned how to count money back. And so I think I was always destined for some sort of,
Finance.
path in that direction.
Yeah.
Serving in healthcare is so rewarding because you get to see, even not being non-clinical, um, the compassion and the empathy that our caregivers and our employees give. It's just amazing. It's very
Yeah.
rewarding.
Well, I mean, we talk about this all the time. I mean, healthcare administrators, I mean, you give the opportunity for clinicians to do what they went to school for, to do what they got licensed to do, so that they can practice that, and you guys can worry about uh, everything else, right? And so I think even, though practices are consolidating into larger systems, or even in rural areas, right? I mean, that's something that a younger generation of clinicians is when you talk to them, they're glad they don't have to do that, right?
Yeah.
They're glad they don't have to deal with these systems that may have to interact with them, but not derive them themselves. So, before becoming CEO in 2017, you were the chief financial officer at Harrison County, and prior to that, at Northwestern Medical Center in Albany. So, how has that? You talked about that being maybe a proclivity, a passion growing up. How has that finance background informed your role as CEO? And I'll preface that with we've had some guests. You're an early guest on the show, but we've had someone with a legal background, a clinical background, someone that went and had more of a tech background, right? So I have to imagine having that finance background, especially in this environment with rural health, is crucial and so important. So tell me more about that. Tell me how
Yeah.
that works.
I believe that the clinical side of me, even though I'm not clinical, I watched my mom, be in healthcare, and so I feel like that give me a little bit of heads up on the clinical side and what they go through. But the financial side, I think, is so important for especially independent rural hospitals, in that. I'm always thinking in terms of financial stability,
Yep.
sustainability, how do we protect the services? How do we keep the care local? How do we make decisions that might still be defended 5 and 10 years from now? Rural healthcare, you don't get an unlimited margin for error.
All right.
And so financial discipline isn't about cutting, but it's about preserving access.
Yeah.
uh, it's also helped me lead some of these projects that we're doing, the replacement hospital, and giving me the ability to understand the financing that it takes to make that actual happen. So understanding debt structures and risk, interest rate timing, and uh, what a fixed rate loan is going to really mean for our facilities. So and then also, I would say finance really taught me what to plan for what could go wrong. And because it's there's always something that could go wrong. Um,
Right.
and in everybody's industry, everybody's life. So
Right. Well, I mean, you talk about having slim to no margin for error, right? I mean, and I don't want to go there and put the weight on your shoulders as to, well, what happens when you get it wrong, right? I mean, you've got some big things on the horizon for the community, and I'm sure have been planning for a long, long time, reviewing the risks, getting outside counsel, et cetera. And I'm sure you made the right decisions, but you never know, right? And so I think your community hospital has can be confident in your background and leadership that you're looking at all those things, and you have to. So I mean, as far as leading the rural hospital for the last 20 years, what does keep you committed to rural healthcare work? What keeps you coming back?
oh yeah, that's a wonderful question. Um, for me, it's really just purpose. Rural communities deserve some of the things that we're working on, the modern, high quality care, just like anybody else. And really, the stakes for us are very personal because it's our neighbors.
Yeah.
I always say that It's my job to take care of the people that are taking care of people, right? And that our patients, are family, friends, neighbors, acquaintances, and that's extremely important. And that's really what drives me, keeps me committed to rural healthcare. Uh, I stay because rural patients shouldn't have to leave home
Yeah.
to get the care that they need, and that's what helps drive some of these initiatives that we have started.
Yeah. Well, tell me a little bit about that. I mean, when you're talking about and even reviewing the care that is needed, or I mean, when you take it, when you zoom out, right? In a perfect world, if you could provide all the care locally, you would, right? If that was a possibility. And
Yeah.
so obviously, that's not a reality in almost any rural community. And so how do you go about evaluating? If we're going to add, and I think I've got some questions loaded to ask about some new initiatives you have in behavioral health, which I know is a hot topic in rural America and just in general in terms of access. But when you're looking at kind of what data do you look at? Is it you just because you've been in your community so long, you know the needs, you've heard feedback, but I'm sure it's more analytical than that. Tell me kind of the process that goes into investing in new service lines and the recruitment, the challenges in recruitment that come along with that. I'm sure.
Yeah, I think that's one of the biggest hurdles actually is recruiting some of the specialists. So we're very fortunate in that I think there's 31 different specialists that are visiting here at our hospital in 18 different specialties. And so it's a big part of our business. I think we do look at service lines, direct service lines to find out, is this profitable, is it not?
Yeah,
There are some that aren't, but it's the right thing to provide. And behavioral health is somewhat one of those service lines. And so I do think it's really taking the look at what does the community need and how can we help support that. So if there is a need for, we have a fairly large pain management business. And we do, several epidural shots and various things that not necessarily are opioid management, but it's various other types of pain management. I think that, uh, again, looking at what does the community need,
yep,
and we have a lot of farmers that have not taken good care of their backs and their bodies, and so that pain management is a way to help them. So
yeah,
that's just one example, but I do think it just takes a good pro forma look at things and understanding, and then also stepping back and saying, is this worth maybe not making too much
well,
money?
right. Right. Does that come in play with, the rural health needs assessment? I mean, are these the sorts of things when that term is floated around for someone like me who's not in the business, right? Um, is that the sort of information you get out of that? Is it more encompassing than that, or is that really what you guys rely on when you're looking at those sorts of things, or not so much?
Well, yeah, so as a governmental entity, because we are a governmental entity, we are not required to do a community health needs assessment. However, we work very close with our public health department and their new community health improvement plan. And really, it just coincides with what we're doing. So we do keep that in mind, as well as, trying to keep our finger on the pulse of the
Yeah.
community. A lot of times our providers are really good about understanding and knowing, what is it that they're referring out that
Right.
we could do safely here. And so that becomes then, okay, how are we going to recruit for this? And I think that's definitely a difficult task,
Yeah.
is trying to find the specialists that will want to come here. And because we're independent, we do work with everyone, all big systems around us, as well as any independents that we can try to get here. And it's so far has worked very well for us.
Yeah. Well, must be doing a lot of things right. Your hospital was named a top 100 critical access hospital in 2023. I mean, kind of tell me about that. What were you most proud of in that recognition? What does that tell you is going right?
So you might laugh, but I didn't even realize that we were up for this, particular award. And it was very rewarding, though, to see from the work of all of my staff and our entire team here. It really does reflect kind of a balanced performance. Chartis looks at, not one thing, but strong results across multiple pillars that include quality and outcomes, patient perspective, I think finance, cost, all of those things are taken into consideration. So that definitely was a very proud point. And I made sure and celebrated that with all of our employees because that designation is really about the care that they do every day.
Right. Right. Well, I mean, you've talked about employees being the backbone of an organization, just reviewing articles and getting prepped for this discussion. I mean, what have you learned about recruiting and keeping great people in a rural market? I know you and I have talked about that in other conversations we've had, and I know it's a topic. I know it's tough across rural healthcare, but the flip side of that is, and then I'll let you answer the question, but I, understandably clinicians at all levels, right? Mid levels, physicians. At some point, there are many of them that are looking for something different than a big system in a big city, a different way of life, more autonomy, especially if they grew up rural or have ties to a rural community. But all of that goes into recruiting. I'm curious what you guys are having success with over the years, and frankly, maybe what's consistently a challenge.
Recruitment for providers are consistently a challenge. Um, uh, because they really are, as I just said this week, it's, the butter to our bread, right? And so they're the ones that help really make this work. And so it definitely has taken a lot of strategy. It's something that as a CFO, I was never involved in necessarily. And so this has been a little bit of a learning curve for me in the recruitment. And I don't have a big recruitment, team. It's yeah, you're looking at her,
Yeah.
basically. So, um, but we have been successful in the last a few years in recruitment. I just recruited a primary care physician and another nurse practitioner.
Oh, awesome.
Um, but again, there's sometimes some that leave too. So there's a little bit of a plus and minus that happens. But I really think that what I try to do is design, especially for the provider community, a great work-life harmony, not balance, but
Mm.
harmony, in that I can try to do everything I can to um, help them from burning out. They have a big load on their shoulders usually, and I have great respect for that and know that we have to do everything we can to um, give them that time so that they feel satisfied in their work.
Yeah.
And then on for all other clinicians, I really think it is about helping them develop. We've worked over the last couple of years in a strategic plan and seeing what our employees really want for lead. What do they want to develop? Do they want to go to a class on a certain topic? Do they, whatever it is? I'm very proud to say that our AVS staff have gotten certification. Almost, well, we just hired two, but every one of them have gone and gotten certification so that
Hmm.
they can be better at their jobs. And we've encouraged this because we want them to feel the professionalism that they really truly are. Our EVS staff are the backbone of making sure that we have infection prevention across this organization, that my floors are clean
Huge for quality.
and it looks absolutely fantastic. So, um, you know, even it doesn't matter what level you are, we want to make sure that we're trying to get you to where you feel that this is a great place to work because they invest
Yep.
in me.
Yeah. Well, speaking of investing in them, making it a great place to work, I have to think building a new hospital, a brand new, sparkling hospital, has to be, whether it's at the bottom, somewhere in the middle, it's on the list, right? When people are looking, should I come work here? Should I come not? I mean, tell our listeners about the project. What made this the right moment to build a new facility?
Sure. And this might be a really long answer because it's been a 6-year project, basically. So we are in the process of building at 83,000 square feet. So we're currently about 45,000 square feet.
Mm,
And that does include our maintenance building, but it's a modern hospital. It does have private, rooms where we were semi-private before. Our ED rooms are very well equipped. We have an OR, an endoscopy suite, and a procedure room, whereas currently we have one OR. So we're really expanding those services and really, giving it that modern healthcare that our community needs and deserves. Our
yeah.
current building is about 70 years old. And so our inpatient wing is from the 1960s. And we have one shower basically for the entire inpatient wing. So having private bathrooms and a private room with room for family to visit or stay was extremely important decision for our board. We did start that formal planning in it was 2019. We started with a facility master plan, and we looked at options to build on our current campus, which is 6 acres and it's kind of landlocked, or to look at potentially moving to a new property. And so the board decided at that time it made better sense to just start with a brand new ground up, facility. So it was COVID, of course, then
Yeah.
afterwards, and the pandemic definitely took our time away from working on this project for a good year and a half. But in 2021, the board decided, hey, let's just look at land. Let's just go see what we might be able to do to to forward this project some. And we were very fortunate to buy 43 acres that is actually parallel to I-35, very easily
Wow.
accessed from two interstate exchanges, very close to the high school, great location, and at a great price. And so it made wonderful sense for us to go ahead and do that. After that purchase, interest rates then started creeping up, and we thought, this might be the time that we better
Just do it.
just do it. So that's exactly how that went. And we, of course, started with financial feasibilities, looking at different financing options. Um, USDA direct loan rates through the community facilities program were great. They provide 35-year fixed rates. And it really gave us the opportunity to lock that in. Um,
The confidence to,
Yes, and the
yeah,
confidence to be able to say, okay, here's the set payments that it's going to take. So it just seemed like a now or never
yeah,
moment.
yeah,
We'd also done some strategic growth work, so we knew we wanted to build, but in the meantime, we made a little bit of investment here on our campus to expand our therapy services as well as our outpatient specialty clinic. And it really paid off. It paid off within actually a year and a half. And that really helped solidify that those strengthen those service lines even before we get to a new hospital. And I think that was really an important factor
yeah,
in um, kind of early growing our business so that when we get
yeah.
there, we're on a good fast track. for that
Yeah.
continued growth.
What would you tell another hospital leader who is facing a similar concern, right? Maybe they're in a facility that's outdated, that's landlocked, that perhaps maybe they've put investment or large investment into already because they've had to. But in an ideal world, with the right financing and the right plan, they would build, right? I mean, what would you? I'm sure all of those things hit the table when you guys were deciding, uh,
Yeah,
let's do it, right?
yeah. You know, I think that's an excellent question, and I believe that I would say do it and don't be afraid.
Yeah.
Um, Trust your financial feasibilities, be conservative, um, but be realistic and just work. I mean, you really have to study it and make sure that it's the right thing. I would
Yeah.
also say garner community support the best you can. Find out, talk to people, discuss it, talk about the current facility. Maybe bring some key people in and say, here's the reason why
Right.
this needs to happen. You know, our
Have it come from someone other than you,
yeah,
right?
our outpatient looks great. You know, I feel like kept up the building the best we can because we thought we were going to be here, you know, forever. But we realized that, especially on the inpatient side, there was no way that we were going to be able to compete
Yeah.
if we didn't make some changes in that area. And COVID also showed us that, you know, for infection prevention, you know, private rooms are that's what needs to happen. So
Yeah.
there were a lot of things, but I really think I would tell everybody do it, just keep going forward, but do your homework, and don't lose hope because it's a long process.
And call Tina if you have any questions at all. She's been through it. I'll offer you up there.
Like I have been in contact with a couple of
Yep.
others that have been asking some questions. So,
Yep. I
and I'm
can
more than
imagine.
happy to help. That is very true.
Yeah. Well, I mean, talking about this new hospital, I mean, recently one of your board members, Renee Fordyce, was selected as the Trustee of the Year award at the MHA convention, which I was at. I was in attendance for. I got to see her walk across the stage. Her family was there. I mean, that was a cool moment. I mean, tell us about Renee and why, even from a global issue, like why board relations and advocacy are just so important for the business of healthcare.
Renee Fordyce is a very unique individual, and she was so well deserving Trustee of the Year. She has been on our board over 15 years. She serves as our treasurer right now, but she is such an advocate for rural health. Her unique ability to kind of bridge a couple of gaps. So she is also, you know, has served as the Missouri Soybean Association president.
Okay.
And so she does bridge some ag and, you know, healthcare industry, but
Yeah.
it really works together well because it's rural. And her passion is so great. She's also an LPN, and so she has a unique perspective to healthcare. I appreciate that from her. I think she's just been an amazing advocate. She is has made me be a better advocate,
Hmm.
um, and pushed me potentially in ways that I didn't realize I could, because she has such connections across, you know, the federal government as well as state government. And so I've really been appreciative of Renee's leadership.
It takes some of those. I can think of those mentors or folks in my life that have pushed me to think bigger, right? And that may be what you're saying, maybe not exactly, but it does open your eyes to opportunities that you didn't know or think were feasible, right? I mean, this new building is expected to be done. We were just talking this summer, or excuse me, this spring, completed this spring, and then open the doors open this summer. What does success look like on day one when you open the doors, and what sort of change management are you expecting from we're moving, this is going to change, so get ready, everybody.
Yeah, we have definitely been working on this for months. Really, success on day one. is three things. It's safe care for patients, calm operations, and a confident staff. And it has taken a lot of planning to get to where we're at now, and we're not there yet. So we are even having, we have new processes, being put into place for the new hospital. We're kind of making some of those processes here so we can test those out a little bit instead of
Hmm.
everything being new. I said, it's interesting. I said, we don't want people to worry about their workflow when they get there because it's going to be hard enough to find the supply closet, let alone,
Right.
a different workflow on day one. So we have plans to do lots of practice with some of our PFAC members. That's the Patient Family Advisory
Yeah.
Council. Members have volunteered to be patients and come in and really help us work through the workflow that it's going to take and make sure everyone is ready and feels confident with that.
Yeah. Is this something you came up with, or was this something where a neighbor or consultant said you should do some role play? Really, it'll make this transition a lot easier.
I that's interesting. I'm not sure where it actually came from. I think we just feel that we know we have one chance with
Right.
our people. So
Yeah.
we know we have one chance with the public, and so we don't want to bumble it.
Yeah.
And we know how important that is. And I think we're all feeling that pressure right now as it gets a little bit closer.
Well, you're feeling pressure. I'm sure there's nervousness, but there's also excitement, right? I mean, hopefully overwhelming excitement to quash all that other stuff. I mean, what would you say you're most excited about?
Oh yeah. Um, it's very interesting. We are excited about and you're gonna laugh at my last one, but the patient rooms, um, improved imaging with the in-house MRI. We currently have an outside MRI, but you have to walk across the parking lot
Uh,
in the weather to get to the trailer. More functional emergency department. I think those changes really directly improve patient experience and staff efficiency, and I think we're really excited about that. We also have some great outpatient spaces. Our therapy department is increasing by, I believe, almost 100%. And we have a very strong therapy department. As a matter of fact, I always say they're the best in Missouri. And I really probably am not far off because they are just fantastic.
yeah.
But I will tell you what is exciting as absolutely the most, and this is from my entire team here, is our dining space. So we currently have a tiny little dining room that might seat 5 people, and we have designed the cafeteria dining area to be inviting for not only for the public to enjoy healthy and affordable meals, but we're all excited about not having to eat at our desks.
Yeah.
And and we have also intentionally put an outdoor dining area with lots of seats so that everybody can get outside and have some fresh air, enjoy
Wow.
each other. Um, you know, nature is very important for healing, but nature is great for those just stress relief. And so being able to be outside, it's been a big design element. Our board has also been very intentional about the design of our hospital, and that from the front door, you can see all the way through the lobby area,
Oh,
through the
wow.
cafeteria to see outside. It was a very intentional, we wanted it to be very light, airy, comfortable, warm, inviting. And I believe that is exactly what everyone's going to experience.
Yeah. I'm just curious. This wasn't something I'd planned to ask, but how many different designs did you look at? I mean, I assume you're working with multiple consultants, an architect, but probably hopefully specialized in healthcare, but um, what did that process look like?
It was a really actually a very interesting process, and that the architects really got us together, our leadership team and our board, and let us go through even color schemes.
Mm.
They would show this color, and everybody got to vote, what color. And we ended up with this wonderful collaboration of we want warm or we want cool colors, and we want it to be light and inviting. We didn't want these bright colors. It was very interesting, but also that came upon having the design of a very nice tall clear story that shows these beautiful beams and light flowing in. As it's really lovely. The architects took a little bit of time too. I'm very proud of that. And that they went around looking at Harrison County to see,
Ah,
what does it look like? What is
how
it?
can we tie it in?
Yeah,
Yeah.
how can we tie it in? They did a wonderful job with the outside of our building and tying that into the Harrison County Courthouse. Is made out of limestone. And so our outside of the building is a beautiful limestone color.
Oh wow. I can't wait to see it. As I mentioned before, I'm gonna get up there and see it, but I'm gonna let you guys get settled before I invite myself for a tour. I do want to shift. You mentioned the loan. The expansion has USDA rural development financing through facilities direct loans totaling 57 million.
Mhm.
How do you think through? You kind of talked about the pros, but maybe for our audience, kind of flush out the pros and cons of this type of funding.
Sure. It is an amazing opportunity to have that fixed rate for 35 years. And I
Yeah.
believe that, in rural hospitals, it really is the way to do that, these types of projects. It gives good stability for that payment stream. And so I do think that is. The trade-off, though, is complexity. There's
Mm.
constraints. There is requirements to take the lowest bid when things might have been maybe a little bit better under a construction manager at risk. There was just a lot of constraints
Sure.
that I think we had to do, and we knew that. We also know that for 35 years USDA tells us what to do, and and probably rightfully so. They've actually invested in us as is great, and it's very. I'm very thankful for that. We've had a great team from USDA community
Yeah.
facilities in the state. Um, I think some of the challenges too, we had our bids came in much higher than we expected.
Mm.
That then in turn, USDA was, rightfully a little bit more nervous. And
Right. Well, that was an interesting time. I
it
mean, for building anything, right? I mean, for starting a project, prices were extremely volatile. I mean, it cut you off, but uh, for viewers who are unaware, right, or living under a rock, that was a trying time to get anything built, much less a hospital.
You're correct. So prices went up. We were about 20% over what we even expected. And so that became an issue. Also, we had the federal requirement for um, Build America, Buy America, in where it affect our sourcing and our costs.
Mm.
Now,
Mm.
we were very careful and wanted to source from United States, but there are some things that just aren't made in the United States. Many parts of medical equipment are not
Right.
made in the United States. And so that definitely put a little bit of a wrinkle in trying to make sure that we could do that. Um, but it, it's just been a great process, and it took really almost 2 full years to obtain the financing needed to begin building. We also, of course, besides internal equity, um, we also issued about $12.5 million of revenue bonds
Yeah.
and private placement through some banks around, and we're very grateful to their support as well.
Yeah. Well, I mean, in a trying time for rural health, just from a financial perspective, I mean, I've heard rural health leaders talk about this before. It's hard to get the funding, right? with the requirements that many of traditional lenders might have today about cash on hand and looking at I mean, everything that goes into a financial model when, again, a lender is looking to go at risk for a project. I mean, what made this different, or what made it easier? I don't know, you know, if you're in that environment, right? But you're in rural healthcare, so I know, finances are a priority. They're tough, but you know, tell me a little bit about that.
I do think that being a critical access hospital, with some cost-based reimbursement,
Hmm.
definitely made the difference.
Yeah.
And so, if we were a PPS hospital and the size that we are, that it wouldn't
Right.
have been possible at all. I think with that, though, came a lot of education that had to happen, not only from our standpoint, but also from our financial advisors standpoint, in that we had to educate on
What
all
that
of the
means.
lenders on
Yeah.
how does this work, and how does this make sense for a small hospital to borrow, you know, all in total, this whole project is $75.5 million.
Yeah. It's incredible. I mean, when I think about even our business, we have experts at Gallagher in every industry vertical, and maybe that's not the case in the lending world, right? Where hopefully there are healthcare experts somewhere that say, "Oh, we know how their cost reimbursement works. We understand critical access hospitals." But sounds like you've had to do education all
Yeah,
along the way.
we did, but again, very fortunate, not with everyone, and
Yeah, sure.
I think that's what helped make the financing available for us.
Yeah. Well, you've said this project isn't just about the hospital, it's about the region, including economic development and jobs, which so often is a critical piece of a healthcare entity in rural America. What ripple effects do you expect for Harrison County and the surrounding area because of this project and this opportunity?
Sure, it's interesting. You know, as we've been building for the last 2 years, I will say there has been good economic activity. So we have builders here. They are going to the restaurants every day, and they're getting gas here, and they're, renting places, and they're, buying goods and services, and so all of those things they are partaking of. It's been great to see that happening. Our builder has given back to the community in a couple of areas, and that's been very helpful. Longer term, though, the economic engine that truly we are, we are the largest employer in our community. We have about 250 employees, and it's really, honestly, it's economic development.
Yeah,
It is definitely the economic engine that does drive that. And as I said earlier, these aren't minimum wage paying jobs at all,
right.
and they're very healthy
Skilled.
wages, as well as great benefits for people that work here. And somebody said this once: healthcare access is economic development, period. And so I think about that, and I think if we weren't
Well
here,
said.
if our facility had to close, God forbid, then what would happen to this area? And that would be devastating for the area.
Yeah. I haven't, you know, I haven't spent enough time looking at case studies. I've seen enough to know what can happen in that situation. And it sounds like you guys are set up for success, and there's so much excitement around this initiative. I mean, you've talked about the hospital not only being from an economic development standpoint, but from community development standpoint, including, education programs, wellness initiatives, support services. I mean, what does that look like now? And then in the future, and why do these activities matter in rural communities like yours?
Yeah. Um, in rural communities, healthcare, the hospital actually often becomes the center, right, for health. and not just treating the illness, but also connecting people for the prevention, for
Horses.
education,
Yep.
and for support. And I think that's why I'm so excited about some of the partnerships that we're trying to do to integrate lifestyle medicine, and community rooted prevention approaches. Uh, for example, we're supporting lifestyle medicine approach that connects that nature-based health,
Mm.
looking at food as medicine initiatives, and that lifestyle programming into clinical services. So these are some of these future things that we're really going to help um, integrate into all of our services. We currently have a weight loss management program. We have we have prenatal care here. We don't deliver babies, but we partner with NKC Health out of Kansas City. So
Yep.
it's been a great partnership to be able to take care of that. We also have a pediatric uh, autism diagnostic clinic. And so we
Wow.
actually see patients from all over the state, actually, because it's so hard to get that diagnosis. And so we're we're providing those services here too.
Wow.
And so again, trying to help everyone and with lifestyle. The weight management came about when you look at the obesity numbers in our county and how can we help move that needle? And we just want to help move
Yeah.
that needle somewhat.
Yeah. Well, I think that's incredible. And obviously, where my mind goes immediately is an employee benefits consultant. How often are you able to take some of these challenges your community has and say, well, you know what? We're the largest employer. What can we do to affect the maybe not necessarily the social determinants of health, but some of the wellness initiatives we can put in place with our own population that may not be a quick fix, right, to cost or to changing health outcomes immediately, but from a longitudinal standpoint are going to make a difference that again we're implementing here and now.
And really, honestly, we are just starting to really scratch the surface with our employees. And again, these are some of these things that we feel in the future really will be a bigger part of what we're doing. And it's interesting because, well, we know we have to do that. How do we pay for it? And how do
Right.
we sustain that? And so that's where we are just having to be a little creative to try to figure out how do we make that work.
Yeah. Well, it's a crawl, walk, run, fly approach, and a lot of it starts internally, and then a lot with many of our clients, they start looking at vendors, and then once they got it figured out, sometimes the vendors take a back seat, right? And that's where wellness initiatives really, I mean, again, that are tied to what's going on with our population. How can we be targeted? That make the difference. So kudos to you guys for going down that path. It's obviously not always the most evident thing that you have to do within a health plan for spend in a number of other areas. But I want to talk about. I mean, you serve on the Missouri Hospital Association Board of Trustees, and you're selected as treasurer in 2024, which, given your background, is no surprise. What perspective, I mean, do you bring from the rural hospital seat that you want statewide leaders to understand?
You know, statewide policy um, has to work in the smallest towns, and so not just the largest systems. So
Mm,
I believe that I try to bring that rural reality to into those statewide conversations, looking at the access challenges, the workforce pressure, the fact that rural hospitals do an incredible amount with limited
yeah,
resources. I also focus on that sustainability and governance and how we make decisions that keep care accessible for Missourians, not just in the metro areas.
yeah, yeah. Well, I mean, when you zoom out across Missouri, what issue do you think rural hospitals need the most help solving right now? I mean, what are you beating your head against the wall on? If you had to pick one thing that you feel maybe the legislative environment is holding you back on, something that you could get help from, right? I mean, if you had the right support.
I think it's hard to pinpoint one thing, but I do worry about financial stability with several of rural hospitals. So I'm not necessarily worried about our stability right now, but it can easily change.
Right.
Or we've got some headwinds for all of us with the Medicaid cuts. You know, yes, we've got some rural health transformation funding, but it's not going to make a dent in the Medicaid cuts that we're facing.
Right.
Um, rural hospitals deal with low volumes. They deal with high uncompensated care, um, inadequate reimbursement at times. And so I just think that um, we really need to figure out how do we keep these rural hospitals in business. And
Where does that conversation start? I mean, when you think about your time at the Missouri Hospital Association, maybe even working alongside the legislative affairs folks there, I mean, talk about the headwinds they face, right? For the lobbying budgets of big pharma and name your other industry, right? To capture and garner the attention that's needed for such a vital issue. I mean, even if you're not involved, right, directly on those, what are you hearing? I mean, what's the pushback?
I will say, I want to circle back to something. I think the regulatory requirements, and it's always something new I have 9 people in my organization that touch prior authorizations
Uh,
out of 250.
wow.
So that's just an example of regulatory requirements, administrative loads, that complexity that the healthcare system has put into place. It really can slow down progress and honestly just adds cost to the system.
Yeah.
So I do think in that financial stability, that whole complexity burden. And I talk about that with some of, people, but, from a federal level, especially, that regulatory just quit adding, additional, you know,
Yeah.
uh, administrative load for us.
Right. Right. Well, prior authorization is something that comes up uh, daily for me. I mean, with clients, healthcare sector, and not, right? And so it seems like we're having conversations all of the time with some of our healthcare clients, as well as just ABC manufacturing, as to why you wouldn't want to sit down, figure out a way to have a direct relationship with your, especially in rural areas, your local hospital, right? What does that look like, right? You got to be self-funded. You got to unbundle your plan, and then you can allow your employees to have direct access, which is a collaborative effort oftentimes with the hospital and the employer base, and it requires that community engagement and understanding of how can this solve problems that we all have. And it's kind of beautiful when it works out, because you start to see the hospital system go, when I work with that plan, I'm not facing those headwinds that I face with unnamed carrier that we're not going to talk about.
Okay. The other thing I think that, at least for us, 340B program is extremely important. And
Yep.
so, we've got to solve that, and it can't just keep being held over our
Mm,
heads. That 340B program was designed for safety net for rural hospitals,
yep.
100%. And so, it's, unfortunately gotten a little bit of a black eye lately, and it's extremely important. We are in business and still in
Yep.
Harrison County because of the 340B program.
Right. Well, I mean, the narrative, I don't want to get into the narrative of big pharma, right? And I don't know that we plan to unpack 340B. I'd be curious of your thoughts. I mean, I know it's critical right now, right? I mean, there's a questionnaire going out to FQHCs, critical access hospitals, that's coming out from HRSA. So I don't know that it necessarily apply to you guys, but well, I guess it would. That's due sometime in April to discuss all of the needs assessments and why this rebate model that they're coming out with is just not going to work. It's just not, uh, and it doesn't solve for what the big pharma's contention is, right? From my limited perspective, that there's, you know, employers, namely covered entities, that are double dipping, right? They're trying to take rebate dollars and 340B. So I can see a sliver of the argument, but it doesn't even compare to everything that it was designed to do, right? And on top of that, it's hard to say, when a critical access hospital uses 340B shared savings to to better do their job in the community. Um, Nowhere is it written that while sometimes you can pass the savings along, you're using those savings to
Yeah,
to care for your community, whether they're
correct.
passed directly on or not, right?
Correct. And some of ours is and some of it's not. And again, we didn't really plan to talk about 340B, but there's all kinds of
It's always there.
there's all kinds of programs that we provide, for us to do lifestyle medicine, 340B has to be there. Um, or we can't really do the extra things that we need to do. So it's important. It's definitely important. And so I think uh, what keeps me up at night is some of those regulatory things that sometimes come down the pike, like the rebate program that
Mm.
it's just not going to make very much sense. Cash will outlay way, can we get the rebate? Are they going to give us the rebate? When are they going to give us the rebate? There's all kinds of issues with that. And the unfortunate thing is, um, I don't believe any of us are defrauding this
Right.
system, and that we are all working very diligently and hard to make sure that we are managing this correctly.
Yeah. Well, again, I'm glad to hear you say that, and hopefully we can take this soundbite, take it to people that make these decisions, right? And you got to give kudos. I know, since you're on the board of trustees at MHA, to the legislative affairs team there. I mean, well more than I do. That entire team a couple of years ago, right, faced a huge uh, roadblock, right? Getting some of the, I believe it was the legislation around contract pharmacies, and pushing back on that, and they got it done,
They
and that was
did.
a huge win.
They did. The Missouri Hospital Association legislative team is top notch. Well, the entire association is, everyone that works there. And it's just been an incredible help. And they are a huge help for especially small independent hospitals. I know they work with all of us very equally, but it just seems like sometimes, they're my back office
Yeah.
sometimes. They're my experts in quality, where I don't maybe necessarily have an expert in quality. They're my expert in legislative affairs, and they're working on our behalf. And so it is extremely important, and the work that they do is I'm just so grateful for it.
Yeah. Well, I'm proud to partner with him. So it's been a fun opportunity just to get in front of you guys. So if you could go back, just kind of shifting gears a little bit, to talk to yourself at the start of your CEO journey, what would you tell that earlier version about leading through change and growth? I mean, there are so many leaders um, like you, I mean, who are new to this role. I mean, the average tenure is very low, right? Um, so you're one of the experts. What would you tell yourself going back?
I think it comes down to really a simple thing, and it's communicate more.
Mm.
Communicate more than you think you need to. Um, don't be surprised by resistance, because change is scary, but if you don't communicate, if you don't fill in that information gap, then rumors will, and misunderstanding happens. And so I think the communication is really big. I think building a support team is extremely important. Um, Focus on those, incremental steps to do that. And then I think finally is be present. Be the boots on the ground. Boots on the ground leadership matters. Going around and seeing people, whether that's in the morning at huddles, whatever it is, being visible. Uh, and especially in a major project, I think it's important too. But presence prevents problems, and it builds confidence. over the past couple of years, and I wish I'd have started this early on, or just in the last year, I've started an employee advisory committee, and it's frontline staff that just meet with me. So it's kind of a mixture of about 8 people across our organization. And I have them be the ears of the organization and tell me, um, what's everyone feeling? How's it going? What is it that it's a pain point? Maybe in your area or what you're hearing. And
Yeah.
I told them from the get-go, don't tell me who it is. Do not tell me any of that, but we just want to try to help solve the problems.
Yeah.
And sometimes, Brendan, it is as much as they just don't understand the whys behind something. And so that's my great opportunity to say, okay, this is the reason why. Um,
Communication.
yeah, what you're suggesting can't happen. And I tell them, and I'm very transparent about, the decision making or what it needs to be. And I find that that has been very beneficial. And I do rounds every morning, and lately it's been very difficult with the new hospital. But I missed a few days in the last week, and I went to ED this morning, and I said, I am so sorry I haven't been around. It's been a little crazy. And they said, yes. And they said, we've been kind of missing you. And so the ED staff calls it tea time because for Tina. So
Yep.
I always enjoy that
Oh,
time
that's
that I
great.
can learn about them, their families, what's going on in their lives.
Yeah. That's so fantastic. I mean, I'm just listening. You have multiple feedback loops, both directly in this case, indirectly through folks that you're asking to give you raw opinion. I mean, I just think that's beautiful. I've heard this happen a lot of different ways, but I would venture to guess that this is well, it's much more real time in terms of data. It's probably much more accurate and unfiltered than maybe what you might get with a static survey, right? And it's constant. So, I mean, versus doing a survey once a year, twice a year, say, hey, what can we improve? This is kudos. I think that's innovative, really. So, um, looking ahead though, what are the biggest opportunities and the biggest risks you're watching out for as you grow services and prepare for this new facility? I think you've kind of touched on some, but talk about that a little bit.
I think opportunity wise, our new facility allows us to modernize healthcare delivery here. I know in other places it is modern, and it's not here. And I think that's where the community is going to be extremely surprised and excited about, and our employees as well. Um, you know, um, I've always felt like there's such potential here. We have such wonderful team members. I can't say enough about the people that work here at Harrison County Community Hospital. They are the most compassionate, and they are just wonderful, skilled professionals that take care of people. And I think that it's interesting because I think one of the biggest opportunities really lies in something that's kind of intrinsic, and
Mm,
that public perception, I think,
mm,
will change.
yeah,
And I think the risks, though, are things like workforce, continuing the recruitment, retention, even though we're working on all of those things, but also just in the near future, that operational readiness for us is is some of the risk. So it's a big preparation for our new facility, and it's taking a lot of intellectual time and effort
yeah.
to balance some of that.
Yeah. Well, I'm curious. I mean, touching on public perception and hopefully the positive impact that this has, right? You got to get it right. You've talked about that. That plays into, I mean, there's the image of the new hospital and what that means and what that looks like and feels like for a community. But then their experience, right, keeps them coming back like any other, like really any other business. Obviously, this is quite different, but how do you manage that perception with the community? I mean, kind of broadening out not just the new hospital, but I mean, what I didn't plan to ask this question, but I'm kind of curious. I mean, how do perception in general, is that something you guys work on? Is that something that's innate? Um,
So
you
a
know,
couple of things that we've tried to do here in the last little bit to get ready for new facility. We know that this is a one-time opportunity to change public perception. And it wasn't that it was terrible, but I think there always is this perception, you know. And so um,
right.
we went through a rebranding process already.
Mhm.
So we've rebranded, have a new logo. We didn't change our name because we felt it was super important for the community to still
Yep.
know it as Hurston County Community Hospital. Um, but I think that has helped change mindsets internally as well as externally a little bit. And so we're kind of on that cusp of just elevating some marketing efforts, elevating branding efforts to try to help keep that in top of everyone's mind. I, and really stop thinking of rural as less than because we can be we're very innovative,
Right.
high quality performing healthcare organization.
Right. You're doing some things as you are have dictated in just the hour we've spent together that people are coming all over for, right? I mean, so, expounding on your strengths, I mean, has got to be crucial, but it's a constant effort, I'm sure,
Mhm.
right? So, well, as we wrap up here, I mean, Tina, I've really enjoyed this conversation. Just tell us, this is a question I like to ask all of our guests. I mean, what's one a mindset shift you believe rural healthcare leadership needs right now? And what's one action those leaders can take this month?
Okay. Well, the mind shift I'd like to have is, and it's a little bit with public perception, is stop thinking of rural hospitals as Band-Aid stations.
Mm,
So it's not just external, but I think internal as well. We need to think, we need to understand where that perception comes from, but also say we do provide life-saving care. We stabilize trauma, manage emergencies, save lives every single day, and that matters. And I think honestly, the mind shift needs to happen to all of us.
yeah,
Um, it's not all that we do either. So not only do we patch up people, but we're also, manage the chronic diseases. We provide the behavioral health. We give preventative care. There's therapy, specialty clinic, all of those things, and people and develop really strong relationships with those patients who trust us for a lifetime and sometimes generations.
yeah,
So I really think that action is be intentional to challenge that perception,
yeah,
both internally and externally. And maybe even how they could do that is look at one service line or care process and say, are we transferring because it's truly necessary, or are we transferring because of an outdated assumption about what we could do? So take it and really try to look at it in a different perspective and don't guess at what people are
right.
saying, but really try to figure that out. I mean, it's just the same as trying to figure out, how do you have telehealth services for neurology or
Mm,
cardiology, or how can we keep these people here? I hear from more than one person that unfortunately we transfer them because they need to see a specialist in the city, and there's nothing wrong with that. They have the specialist there 24/7, but sometimes it's a very little care that is given, and then they're sent back home. That puts a huge burden on families
travel.
and
Yeah.
we can take care of them here. And so that's what I would really say. I think that's the one
Yep.
action is really look at those service lines and let's see, can we
Right.
keep these here? Is it safe to keep these here? Are we equipped to keep these patients here?
Yeah. It's the old adage of what's the why? What's the why behind this action we're seemingly taking automatically, right? I love
And
that.
And just so you know, as I was preparing for this, um, I'm thinking, I'm doing this. This is what I'm going to be doing. It's just something that really made it hone in for me, um, on what do we want to change?
Right.
Where does our mind shift need to change, and how can we do that?
Yeah. Well, Tina, this has been a fantastic. That's a great spot to end it on. There's so much that we didn't cover. Perhaps I'll have to hit you back up for a round two, but this was so great having this conversation. I can't wait to see and get this out, for listeners. But thank you so much for coming on Leading Rural Healthcare.
Yeah, Brendan, thank you again. I appreciate your time.